In this video, I'm going to show you a few tips that you can do when you're trying to work with your patients, upper body exercises in a seated position. So a lot of times if you're working with a patient in a long-term care facility, maybe in a hospital or even in home health, they're going to have other issues, maybe with balance, breathing issues, limited standing tolerance. So in a lot of cases, they may need to sit. So these exercises for the shoulder are going to be in a seated position. And the first thing I always have my patients do, if they're safe, to be able to remove them, or take these armrests off, get them out of the way, because when you have patients performing exercises, let's say bicep curls, they either have their elbows way in like this because they're trying to get in around the armrest, or they hold them out to the side like this, and that just really strains and stresses the shoulder joints and the elbow joints, unnecessarily. So I take those off as long as they're safe to do so. The first exercise I'm going to show you using dumbbells is going to just be a front dumbbell raise or a front shoulder raise or whatever you want to call it. I'm just going to go up, and I try to keep my arm down below about 90 degrees. Now there's no exact perfect measurement with that. I just tell the patient, let's just kind of keep it down in here, because once you go past 90 and start getting overhead, you can irritate the subacromial structures here, so we don't want to do that. So I tell them, just stay down in this range, something like that. If you need to work on range of motion, and you can even add in some cane non-resistive exercises, to make sure you can go overhead. I have my patients do tabletop slides. Those work really well. Just nothing too aggressive to irritate the shoulder complex. Then you're going to go into lateral raises or side raises. Some clinicians will call them shoulder abduction. And what I do with that is I have my elbow bent when I'm going up, so not straight out. I like to bend it just a little bit. That does take some pressure off the elbow joints, and so for a lot of patients to report, that's more comfortable to be able to do it that way. And then lastly, we're going to look at internal and external rotation for the rotator cuff. Now this isn't as ideal as having bands that you can pull on or go out and do extension. So we're just going to use the dumbbells for this video. My elbows are by my side, and what I'm doing is I tell patients that we're going to open and close the gate. So just like this. And when you go back, I have the patient kind of squeeze the shoulder blades together a little bit, kind of a pinch, just kind of go back 2 to 3 sets, 10 to 12 repetitions. Again, that's not as ideal as using a band where I can pull in or a band where I can pull out. A point to also make is I typically would not have my patients push overhead. I'm not saying that's bad. I'm not saying you can't do it, and a lot of people do it. I'm not saying you can't work into that, but initially I would say with these more basic, down below the shoulder level. I hope these tips help to try to improve your patient's ability to use their upper extremities and make some of your exercises a little safer for your patients.